Recently, the CDC said more than half of Americans will be diagnosed with a mental illness or disorder at some point in their lifetime. It's caught the attention of lawmakers and law enforcement, so much so counseling becomes mandatory for police officers in East Point. CBS 46's Savannah Louie has more on the story.
I spoke with the police chief today. He tells me that since this policy was put into place last week, two separate groups have gone through the mandatory mental health services. Shocking scenes become disturbingly familiar.
We've had officers see burning victims in cars. We've had them see deceased children.
East Point Police Chief Sean Buchanan sees even the toughest transformed by trauma.
When you start as a police officer versus your career, a lot of times it's two different people. And it's just because of the cold-hearted things we've seen.
That's why every East Point police officer must now get mental health counseling after responding to a gruesome scene or fatality starting this month.
In this profession, if it's voluntary, it's not going to happen. A lot of officers want to maintain that macho type attitude, but we know through research that that is a real issue.
Studies show police have a shorter life expectancy, higher rates of health problems like heart disease and mental health issues, and worse rates of divorce, substance abuse, and suicide. It comes as legislation requiring insurance companies to cover mental health like medical conditions heads to the Georgia Senate. Other law enforcement agencies across the metro may require officers to undergo an emotional debriefing after a traumatic incident, but the chief says this is different, knowing firsthand how beneficial counseling can be.
Just have someone that listens and understands and give me some remedies and help me think of things in a better light is really been beneficial to me, and that's why I want our officers to experience this as well.
Reporting from East Point, Savannah Louie, CBS 46 News.